My name is Mrs. Susan K. Bodie. I'm from Philadelphia, PA.
Susan is one of those memorable patients who always kind of engages everybody around her. She's a very friendly, outgoing, boisterous kind of personality who kind of brings up the mood when she's around.
I woke up, I couldn't stop coughing. We took a trip to Frankfurt. They checked me out. They said that my blood pressure was sky high, put me back in a room. While I was in having my second x-ray, that's when I had my heart attack and I didn't even know I had it. Independence Blue Cross sent a nurse out to check me to make sure I was doing everything I was supposed to do. She asked me if I had a mammogram lately. And I said, I couldn't tell you the last time I had one back in '01. And she says, well, we recommend you to go get one. This one nurse came in, she said, Dr. Sugar wants to talk to you. So I went in and she said, I found something. It's real tiny and it's up here. I found out it was stage 1. I also found out I had 2 more when they did an MRI. That was stage 2 and 3.
She had a very hard time with the getting diagnosed with breast cancer, as naturally most women are.
I came home and I cried and I got mad. And I started tossing things around because I was so mad. But now I'm thankful for her to find it when she did, because I could have went on a few more years not knowing that I could have died at any given moment.
She had to have a mastectomy, which was a difficult decision for her, but she finally came around and realized that she was going to have to do it. She got through the surgery and she did amazingly well. Again, she kind of made friends with all the nurses. She's just one of those people who everybody gets to know just because she's so friendly. Whenever she came in for a follow-up visit, not only did she see me in the office, in the exam room, but then she would make the rounds and talk to everybody who works here, and she was always kind of brought up the mood of the place.
Talking to Dr. Sugar, Ronnie, she's so special in my life. She's my heart. She makes me want to hug her every time I see her.
She told us that her father was a fireman and that he had this bell, and she kind of described it. I didn't realize what it was going to look like.
My father was a Philadelphia fireman. He was also in the Philadelphia Reserves. And they were destroying a firehouse, and he took the bell. And I said, you know what? I beat this. I don't have cancer right now. And I felt that Daddy's bell would give people incentive to not give up. And when you do find out that you don't have it anymore, ring that bell for all you can, because that's what it is. It's freedom.
It was a very powerful thing. I was very touched, very honored that she would donate that to our office.
I think it's a great purpose, because it's not only me ringing that bell, it's all these other people that can ring that bell.
I was in Dr. Sugar's office after my surgery. My surgery went amazing. She told me that no cancer cells were found during the surgery. I just felt so blessed that, I was going to live. I have a 21-year-old son, and having to tell him that I had cancer was like the hardest thing I've ever had to do. And when I came out, they had me ring the bell and told me that it was someone in the office donated the bell and wanted to document who had rung the bell and what their journey was.
It's just a feel-good thing. Patients ring it, they feel good. Like Susan said, it makes you feel like you're winning when you ring that bell. Anybody who wants to really can ring the bell. But patients, we do ask patients if they're interested in ringing it when they finish their treatment. So either when they're done with their surgery, when they're done with their chemo, or done with their radiation treatments, or anytime they come in. I think it empowers them. I think it makes them feel good. I think it makes them feel like, I finished my treatment, or I'm, finished the year or whatever, and it just makes them feel good to ring it. And I think it makes them feel kind of connected to the other breast cancer patients that they may not even know.
To hear someone that has gone through the same things that I have felt the same emotions that I have, I knew what she was talking about, and that really touched me, and I knew her struggles, and I felt for her struggles, even though I went through my own.
Go get a mammogram. First and foremost, go to Dr. Sugar. No ifs, ands, or buts. Go to Dr. Sugar.